All right, welcome everybody to a new episode of the Playing Games podcast, episode 15. And today we have a very special guest, fourth year physiotherapy student, I think I'm correct.
Yeah.
Keefe. Keefe, why don't you introduce yourself a little bit?
My name is Keefe. I'm a fourth year physiotherapy or physical therapy, wherever you are, student. Um, I have a few months to go before I graduate. I have a Instagram page that I post about just rants and usually just frustrations I usually have with the field or just stuff that I find interesting. Yeah.
Okay, cool. Yeah, I definitely wanted to, we definitely are going to talk about some of those, I want to say myths, but just like misunderstandings that
Yeah.
people have
Yeah.
about social media, we could say.
Yeah.
But a big one that comes to my head, one that I see a lot, is that myofascial release.
Oh yeah.
I see that
Yeah.
all over TikTok, all over YouTube, and I
Yeah,
mean,
yeah,
I guess I have an understanding of that, but
yeah,
even so, I'm always like, I don't know. I don't know.
yeah.
Why don't you go ahead and speak for that a little bit?
Um,
See how see the claims and then go after the reality.
yeah. Just to see where we're at, like what do you understand about like myofascial release or like what have you seen about what's it? Because like what I've seen it might be different from what you've seen because I've been in the field a lot and then like sometimes people just post like silly stuff. So
That's true. You probably have seen maybe worse stuff than I have. I've
yeah.
seen stuff like, you're able to stretch fascia, which
Yeah.
I'm aware that we can't do that because the amount of
Mhm.
force it requires to do that is insane.
Yeah, yeah,
And I don't know if you want to get into that in a bit,
yeah.
but also I think there's different types of fascia. So when I've read I've seen actually videos on people saying, well, you can't stretch fascia, but you can stretch different types of fascia. And they talk about, well, how does your fascia stretch when your muscles grow? Like it needs to
Yeah.
stretch. And I've seen things like that. But yeah, I the main thing I see is that just stretching fascia and using a foam roller to do that, I'm like, absolutely not. You can't.
Yeah.
It feels nice. It feels nice, but
Yeah. Yeah.
you're not doing shit
Yeah.
to your fascia.
With I think one big thing like people should know about physical therapy or in fitness in general, especially with myofascial release stuff, right? For example, you see on TikTok, they're like, I'm doing body work or like, I'm doing this so I could move better and like prevent injuries and stuff like that. Um, Rehab and wellness and just feeling good is like a spectrum, right?
Mhm.
Like, like for example, like myofascial release, like bare bones, that's just a massage. Like so sometimes it's kind of really funny to see like bodybuilders. You're like, I work really hard. I come here, like 3 times a week. I go to my myofascial therapist. Like, dude, you're just getting a massage. Like you can say that. You can say that. It makes you feel good. Like it temporarily gives you a range of motion, like more ranges of motion, and it might relieve some of your pain. But like for whatever reason, um, it gets into like the science of pain and stuff like that, which is like super complex and like I don't really have time to dive into it. But we just have a thing called like you can think of it like desensitizing something. So for example, right, if you hit your elbow on like a table or something, you rub on it and it makes the boo boo go away, right? So um as lifters or bodybuilders, sometimes we get like not we, sorry, I'm not a fucking bodybuilder, but sometimes lifters they get like sore spots on their necks, stuff like that. um Whatever like you do, it feels good, but it does not have to have like a really complex explanation behind it, you know. And what you refer to as the we need a lot of force to deform fascia. Yeah, that's true. Um, there is like a lot of papers that cover this. Um, so let me try to. I have it written here.
Yeah, I don't
So like
remember what
this,
paper it was, but
yeah, it was this a fundamental critique of the fascial distortion model and its application in clinical practice. And I'm not gonna say like like fascia is like useless or whatever. Like I've seen some applications of it, like being trained in strength and conditioning aspects, but I don't know what it means for pain or um rehab settings, right? So like that's a lot more complex. Yeah, I would say
yeah,
yeah,
sorry. Yeah, I feel like people really overestimate fascia a little bit, and I'm not saying like it's not important. Yeah, I think it
yeah,
it, it can be in certain
yeah,
scenarios. Maybe I don't know how good it's worth in the physiotherapy world. But man, I
yeah.
I hear the word biotensegrity like 10 times every hour. Do these do
Yeah,
every single like functional
uh,
pattern kind of thing, and no hate on those guys, but I'm like I think you guys are
yeah, yeah,
overreacting on how on what
yeah.
like do you even know what biotensegrity is? Like really, like not just like oh everything's interconnected. It's that simple. It's
Yeah.
not.
I've seen with I think with a lot of physical therapy or even fitness stuff, especially in fitness, there's usually some trend and then like something that has a little bit of good truth to it. Like for example, I don't know, like heat therapy or like whatever the fuck, right? And then people would jump on it and then they'll start to overblow the effects. And then like people would be like, what are you talking about? And then like I think one part of it is sometimes we dismiss things like way too early. Like at least for me, when I was getting into like physical therapy, I realized a lot of shit I learned in school was like basically bunk, like just useless, like outdated stuff. So like I was very, very skeptical on many things. And I thought, yeah, I was very, very skeptical on many things and for good reason. And after that, like right now I'm on a stage where like, people blow things out of proportion, but sometimes there's some truth to it. Like there's some like I said, there's some people working with like fascial stuff in the strength and conditioning field. I'm not too sure about that. Not my expertise. But what have you heard about it, like in the bodybuilding world or fitness?
Um, Honestly, I have no idea in what context would fascial release, I guess, uh,
Yeah,
plays an important role in the field. I mean, like you said, it makes people feel better. Then that's fine, especially after
yeah,
bodybuilders or people who
yeah,
work out over long periods of time and
yeah,
they just go to the massagist or these myofascists, I think they're called, and then they just do their massage or whatever, and then they feel a lot better. They do cupping
yep,
therapy, all those things,
yeah, yeah,
and then they're like, oh, like this absolutely works.
yeah,
And I mean, I can't give them straight answer just because I haven't like really gone into the literature. And I don't
mm-hmm.
know if it's just me, but I feel like yes, I love the literature of physiology, but and biomechanics and that stuff. But when I
Mm-hmm.
read physiotherapy literature, I feel like it's just a whole. Even though it sounds similar in some cases, I feel like it's just very different. Like I feel like you just got
Mm.
to consider uh, different sort of things on how to read, a literature paper. Because whenever you read a paper, it's not just like oh, like this is what the paper says, this is the discussion
Yeah,
that's it.
yeah, yeah,
You kind of have to read a little deeper, like, okay, well, there's some limitations here that they didn't discuss.
yeah,
There's some other things
yeah,
that the participants and stuff like that, whatever.
yeah,
But
definitely, 100%.
um, I will say, uh, in terms of when it comes to like manual stuff and like manual therapy, I think from what I understand, a lot of the results that people feel that they feel better and things like that, that's not really structural, like
Yeah,
structural. It's more
yeah,
so like uh, what's the word? Neurological, I guess you could say, like some things happening inside the body
yeah,
neurologically or physiology. with your
Yeah.
physiology, where like it makes the pain sensations diminish
Yeah.
in a way.
Yeah. I think what the general population has to understand that pain is really fucking like unpredictable and complex for some people, right? For example, people who get their limbs like amputated, like it's pretty famous. It's like phantom limb pain. So like people feel pain in their limbs when it's like gone. So like it's really hard to explain it. And for especially with injuries, like not to say like, no pain is like structural and stuff. Like obviously if I get ran over by a car, yeah, like that pain, like it's pretty obvious, like I got ran over by a car. But especially for chronic issues, a lot of physical therapists or people, they try to find a like a structure or like a cause or a one sole problem that this person didn't have that caused the pain. Or once we fix that, the pain will go away. For example, low back pain. It's really prevalent. It's like chronic. It's like the leading cause of disability. Like nobody has the cure because like, if somebody did, it wouldn't be the leading cause of disability. And what we found is like in the research papers, it's like work satisfaction was correlated with low back pain. So like for example, if you weren't satisfied with your work, if you were depressed, so a lot of like psychosocial stuff. Not to say like if you blow your back out on the deadlift, it means you weren't satisfied with your job. I'm just being like in general, like for the general population, it's just pain sometimes is a symptom of your like life, right? Like for example, if you've ever dealt with any tendon pain, for example, benching, like sometimes you get like rotator cuff pain, like front of your shoulder, or like jumper's knee. That pain is that could be a really good teaching tool for somebody because the pain fluctuates like crazy. Like in the morning, you feel a bit stiff. You warm up for like 20 minutes, and the pain is just completely gone. And if you overdo it, a few hours later, your tendon is gonna like blow up at you. It's gonna like start like screaming at you and stuff like that. So like, yeah, a lot to answer your question, sorry. A lot of manual therapy is not to say it's desensitization. Like I wouldn't say it's useless, but a lot of it is marketing and it is overblown. But like I would recommend people to get obviously not an hour of manual therapy depending on your issues, right? like like if you have low back pain, you just want to get a massage, yeah, go ahead, like be my guest. Yeah.
Yeah, and it's a it's a whole different world too. Like on social media, like you got the optimal biomechanics, muscle building kind of people, and then you
Yeah.
got the whole pain relief symptoms or the whole physiotherapy kind of world. And I mean, at the end of the
Yeah.
day, it's all under that fitness industry, which is
Yeah.
just
Yeah,
honestly,
it's like a spectrum.
Instagram is a whole cesspool of this stuff.
Yeah,
So
you can say that.
I've heard, and speaking, I mean, on your last thing about fascia and the bodybuilding word, I've heard some people say that fascia can transmit force. So if you train it, I don't know
Oh,
how you
yeah.
train it, but
Yeah.
I don't know how that applies. How you can train fascia in a way that's applied into like, okay, I could increase my bench or something like that. I know fascia can transmit force, but I also know it's extremely complicated. I don't really know how. So
Yeah, yeah. I'm honestly speaking, I'm not the best person to speak about this. Um, I have not seen any like credible people that talks about pain and like fascia stuff, but there are some strength and conditioning coaches. Wait, there was one I found. Give me a second. Uh, he has a whole like course and stuff like that. Danny Foley, yeah, he
Danny,
has like, yeah, they run this education system with like actual strength and conditioning athletes, like NFL players, stuff like that. And I think they focus on more the variability of movement. And they talk about how like fascia is what like keeps stuff together, which just makes sense. It's just what fascia is. Like that's his job, is to encase stuff together. And yeah, they talk about like how like the body is like complex. And the guy who I just stated, he's a good middle ground in all of this, based on like a couple of podcasts I've heard. Like he knows about all like the woo woo things about like fascia, like people saying like fix your ear to like fuck up, like fix your ear to like get rid of your toe pain or whatever.
Yeah.
Like yeah, so
I was actually about that. I forgot the name of that. Where it's like, or if you have a headache, rub. I think it was rub this part right here
yeah,
three
yeah,
times or something like that, or
yeah,
do it like
yeah,
5 times.
yeah,
What like it, how do you feel about that? Is there any research on that? I have a book about that too. I think it's a Chinese book.
yeah,
I don't
yeah,
read
yeah.
Chinese. It's in English, but it talks about that because I got it because I'm like, well, this is interesting, and I've tried it. I've tried it to my friends and my
Mm,
girlfriend too, and sometimes it works. Some people say it makes them feel worse.
yeah,
So I mean, I don't know. I haven't seen any literature on it. I haven't been able to find
yeah.
any.
I've seen one for menstrual pain. It was this double blind study that they did, and the results were kind of promising actually. But there was one thing I it was this they did it in Iran. I saw this paper, and they did it, no, they did blind it, but they didn't double blind it. So like I don't know how you would double blind it. Maybe you teach it to another person and tell them this is the spot rather than that one. But yeah, they showed like better improvements in the one that was in the right spot. Um, but it was by like 1.5 or 2 on the pain scale. So like that's from a 5 to a 3, which isn't nothing, but there was some limitations in that study, as in like, it wasn't double blinded. And we know in um, the literature that the practitioner's expectations or how they present themselves does have an effect on the outcomes. So for example, if the practitioner know he's giving a sham, he might not be as convincing to the patient if he was doing the real thing. So
Yeah,
yeah,
and
I
I
don't know.
think
I think it's
there's also like placebo too with stuff like that, right?
yeah, yeah, yeah. I think a lot of people like they we have a warped perception of what placebo is. So like we think of, like, for example, the general population. We think of placebo as a sugar pill, right? But if you just took a sugar pill and there was no context behind it, it wouldn't do anything. Like there has to be context behind it. For example, a doctor has to be there. He has to say these are the effects that we expect. Blah blah blah. So those are what that sort of effect is what we call in the literature contextual effects, right? So like this is everywhere, as in it's just a description of what's going on, right? So like if you walk in a doctor's clinic, subconsciously you're gonna think, oh, is the doctor nice to me? Is she rude? Is the place clean? Is it this? Is it that? Like, how does he carry himself? All this plays it plays into our biases, and especially with something with unpredictable as pain, this can drastically change like the outcomes. And when you talk about placebo in that sense, you also have to talk about nocebo, which is the complete opposite effect, which is what my page usually like speaks out against, because the downside of people just fear mongering and stuff like that about injuries and stuff like that, it can have a negative effect on people. So like um stuff with like lifting with a rounded back, right? So like people will come and then they'll be like, you know, I'm scared, like I tweaked my back once and now I'm afraid to round it again, blah blah blah, stuff like that. Like it really does have an effect on people, especially with people that come to physical therapy and they talk about like posture and stuff like that. And it's just a really hard conversation sometimes because you have to change these people's beliefs. Um, yeah, because it's completely different than what you see in on social media where people are trying to like sell you a problem.
Yeah, I mean, there's always disagreements on social media too, whether they're physiotherapists, and I mean, they could be wrong, but they've been doing it for so long.
Yeah, yeah, yeah.
They don't even
Yeah,
want to.
that's
But
one of the things that like pisses me off. It's like the people who are like most physios, I would say, are nice, but the people who usually aren't are the really experienced managers. Like they're the ones that are like, I'm doing it this way. This is the only way that I'm gonna do it, and it's the only way that's right. And with a field, you can think of physical therapy as non-linear and as like complex and just all over the place as like fitness, right? It's like imagine your manager is like a guy who does only hit workouts to build muscle. It's just like, dude, like maybe there's other ways, you know? It's like, no, I've been doing this for 30 years. Like it's my fucking job. Yeah.
yeah, and I mean, another thing is that a lot of people always like try to figure out like the source, like how you brought up before, like physics trying to bring back like a source of pain, like
Yeah, yeah,
like a like an X answer, right? Like, well, what's
yeah.
X, right? And it's just that. And a lot of people, and I used to do this too. It's like, oh, well, my shoulder hurts
Yeah,
today. Let me try to figure out what it could be, or like,
yeah,
oh, like
yeah,
I my muscle I moved it the wrong way. What happened to it? And I
yeah,
spoke
yeah,
with a physical therapist I used to work with in a gym. I was a trainer. There's a
yeah,
physical therapy section. I didn't work as a physical therapy
yeah,
assistant, but I'd go up to him and he goes, "Dude, you know your body. You're living human being. Your body's not perfect. Like shit's gonna happen that might not feel comfortable one day,
yeah,
but that doesn't mean you have to get to the bottom of it. Like
yeah,
it could be
yeah,
there for, it could be there for 4 months. It could go away in 4 months, or it could be there for a day. It could go away in an hour. Like it's really complex. It just starts getting
yeah,
serious when like it starts getting very painful. And it's not going away. It becomes chronic,
yeah, yeah,
and that stuck with me. You know, like for example,
yeah,
like the other day, like my shoulder felt like shit, but and then like 2 hours later, I'm like, oh well, that's good. Without
yeah,
having to be
yeah,
like, oh, it's my rotator cuff. Like, let me do this or fucking
yeah, yeah. Um, with stuff like that, I think most people they focus too much on the micro stuff. So like they'll think about, what part of my rotator cuff muscle is weak. Why can't I do this? Is it because I don't have enough range in this motion? All the while they're benching like 5 times a week. I'm like, dude, like I can't fucking do anything if you just bench 5 times a week. Like, like I can't give you like an exercise that will fix everything, right? Like I have to look at your programming. So like, yeah, a lot of people they tend to focus on the micro stuff. For example, in fitness as well. And I used to hate on like people who focus on the micro, but sometimes recently I think sometimes it might be for the better because like okay, like for example, someone who gets into fitness because of I don't know, like keto or like some fat diet or some fat workout, hopefully they'll transition out. But these are like these things, they attract people to like the general population to fitness, which is what I want, which is good. Like, this is good. But the bad thing is when they stick to it and then they're like, this is the only way you can do it. And then they're like, oh, this has like 50 million benefits. And I'm like, all right, man, like, you know, it's good to get out a little bit.
yeah, people become very stubborn.
Yeah.
Um, but what else? What else was I gonna bring up? Well, so that being said about pain, one thing that I see a lot of people wear, whether it's gymnasts, cheerleaders, you see this on documentaries,
Hmm.
even people in the gym or martial artists, they all like to put on kinesio tape. I think that's how you
Oh,
pronounce it.
yeah, yeah.
And
Kinesio tape.
I mean, I was in I was in my class. I think it was like my engineering class because I'm in biomedical engineering.
Mm-hmm.
And one of the student groups were talking about the benefits. I think they were like in PT or exercise physiology. They're talking about the benefits that they were learning of kinesio tape, and I'm like, I think this is a bit outdated.
Yeah.
I don't think they like it was saying like it helps stabilize the joints, it
Yeah.
reduces pain, it um, I don't know. I couldn't speak on that, and I don't
Yeah.
really speak on that in front of the whole class.
Um,
I don't
yeah.
want to be that guy. But in
Yeah.
my head, I'm like, I feel like there's more to this that they
Yeah.
haven't. taught you guys?
Um, I have a whole list on like so when I was starting out in PT, like when I was close to ending PT school, sorry, I had a like a revelation where like I went through everything that I thought I knew or like what our common themes are in physical therapy and just wrote down like, what are the troops and what are like the blown out marketing stuff. And kinesio tape is like I spent hours like reading on kinesio tape. And the easiest way to think about it is, dude, it's fucking tape. Like it's it's tape. Like come like stabilize the joint. Like, dude, like it can't resist like 3 pounds of force. Like it'll tear. Like it's fucking tape that sticks to your skin, right? like the studies that we do have on it is kinesio tape. I want to make this very clear. It's different from rigid taping. From like, for example, in sports, sometimes you see people like taping like a whole joint so it doesn't move, similar to like wearing wrist straps and stuff like that. That's different. Kinesio tape is just like it doesn't really restrict any movement. It's just colorful tape that you slap on. Athletes and other people do it for like like whatever hypothesized benefit because they're fucking athletes. They'll take whatever 0.0001% that they can get. But even still, like if you look at kinesio tape, like what they propose is something about muscle activity stuff, something about reducing pain, which I guess like it's better than doing nothing. But it's like what I usually recommend to people is okay, get your basics done. Like as in what's really like aggravating your pain, what caused it if there is a cause, and then what we can do to get you back to it. But the problem is people look at something like someone going through rehab and that tape may be like a reminder for them. For example, if I tape my shoulder like from here to here and I make it like somewhat tight, it can be a reminder of hey, when my shoulder gets to this position, the tape gets tight and I'm like, okay, I should avoid this position for a while. It's like a good reminder, to stay out that range for a while. But most people don't use it as that. They just slap it on and hope, like, pray to God and hope for the best. Right. I want to see if I can find the studies I have on it.
Yeah,
Um,
I wouldn't even know how it could stabilize a joint.
yeah, it's just fucking common sense. Like,
I wouldn't know the mechanics of that. I mean, if there even are any, it's like how
yeah,
I don't know. I can't. Maybe
yeah,
somebody out there can, but I can't.
like from what
I
I've
can't.
seen,
And that's what I ask. When I'm like, when somebody tells me like, oh, like, or like a friend's wearing, I'm like, what's that for? And they're like, oh, it's taped. It helps stabilize the joint. I'm like, how?
yeah,
They go, well, I mean, I don't always expect them to answer that because it's also not an easy question when you say something
yeah,
stabilizes the joint. But at the
yeah,
same
it's
time, I'm
just
like,
yeah,
be like, does it feel better? And they're like, yeah. I'm like, well, I mean, I
yeah,
guess, like,
yeah,
but I
yeah,
don't know. I'm not convinced of it. I
yeah,
don't really wear it. I don't find a need to wear it.
yeah.
I don't
Um,
want the need to wear it.
yeah, from what we can see in the literature, I made a post on this. Like, if you guys if people are listening, you can go on my profile. I made like a 2-part series on patellofemoral pain, which is it's just a fancy word for knee pain. It's just like a exclusion diagnosis is okay. It's not your patella, it's not your fat pad, it's not your quad. So it's just like the joint pain, like not the medial joint line as well or the lateral. It's just like the middle of your knee hurts. Okay. And taping is one of the most like common treatments done for it. And yeah, in that post I cover it. There's double blind studies that's been done, or double blind or blinded that's been done. That was really fucking funny because I remember this one study that put on a tape for these participants, and then none of their values changed, so they were there just for fucking nothing. It was really funny.
Do
And
you do you think you could elaborate? Because maybe for some people who don't understand, what do you mean by double blinded or blinded study?
right,
Okay.
so when we say blinded, Double blinded. Okay, let's talk about blinded is the the participant doesn't know what medication or what treatment they're gonna get. So like for example, a placebo like sugar pill or like the real treatment. So they're blinded to that. Double blinded is where the practitioner or like the person giving the treatment doesn't know as well. So like how this would work in kinesiotape research, I need to look at the paper again. I think it was only single blinded, where like um it was compared to another taping format, which it was like tape. Like for example, kinesio tape, they usually have a guide for you. You have to tape this way. So they just went the opposite direction to see if it did anything. And I think both groups showed like no outcomes. Yeah. So like that's what blinded and double blinded means. And I think this is really important in research that you can do it because it reduces like some amount of bias. For example, like um, a practitioner bias and like patient bias as well. You know, yeah.
Yeah, yeah. Because I just wanted to elaborate on that because maybe some people are like, what does it mean
Yeah.
by blinded or double blinded? Um, but yeah, so I mean, I can't really think of a. Is there any like common injury or treatment where people would wear kinesio tape? Is it just when their joint feels unstable, or is it
Um, I
like when they
wouldn't.
have like an injury or like a fracture? Like,
Oh no, not for a fracture, dude. Fracture, you get put in the boot or something. Like you're
yeah,
put in a cast. Like, like. So kinesio tape you usually see in really active populations. You know, for example, right? Like again, we're talking about the spectrum between fitness and rehab as well. You know how athletes have like a good luck charm, like like I think Patrick Mahomes where it has lucky underwear or something like that, and like they have superstitions. Like everyone has read it, like everyone has their pre-game meal, stuff like that. You're not gonna go up to an athlete and tell them, that underwear is not really lucky, right? Like obviously they fucking know that, right? But I want people to know that as well. Like kinesio tape, like sometimes people slap it on. It might make them feel better. It might not. But you just have to know it's fucking tape. Like that's it. Like for example, like I could tape this hairbrush on my back and make up like 10 different benefits for it. Like yeah, like you could justify like any fucking thing in physical therapy because and fitness and wellness because it's so broad. Like I could say the hairbrush because of its shape, it keeps my spine rigid, and whenever I bend over, I have a reminder to keep my like I can make up 10 different things. So like you really have to keep an eye out on like stuff like that. And I wouldn't say it's one of my concerns with kinesio tape because at the end of the day, is it really that harmful? Yes, if you're not getting any other treatment other than tape, then yeah, there's a problem. But other than that, yeah, I don't. Yeah, other than that,
yeah.
like it's not really that.
I think the problem relies like when people like start thinking it's gonna be the solution. It's literally a band-aid. Like
Yeah, yeah,
uh,
yeah. It's even worse
at
than a
most,
band.
a band-aid, I'd say.
Yeah, yeah,
Um, but was yeah, people use that and they just think that over time that alone is going to heal the thing. I'm like, no, there could be a bigger reason, or like I said, it could just be something that your body just messed up on, and it's just healing itself, and then just let it
yeah,
rest.
yeah. It's just like most of the time, pain gets better on its own. It's just
Yeah,
like you've
and
tweaked like 10,000 things before you go back to its own, whether you tape it
yeah,
or not.
and people can make up anything for from anything. Like
Yeah,
put your hand in fire to kill the bad bacteria.
yeah,
It's helpful, or like stuff like that. Maybe that's a bit exaggerated, but you
yeah,
know what I mean. Like you said.
yeah,
But speaking of injuries, one thing that's also very popular is icing injuries,
yeah.
and I've read about this a little bit, and from what
Mhm.
I understand is that icing can be nice,
Yeah,
but too much icing may not be the best thing, but maybe like 10 to 20 minutes of icing a day, maybe less. I think it helps like prevent like immediate I
Mm,
guess,
mm,
inflammation or whatever
mm,
happens when you get an injury. But over
mhm,
time, like in the second phase of something of an injury, it
mhm,
can delay progress just because
mm,
um, it could just reduce recovery by a little bit, something
mm.
like that. I don't know if that's on par with the literature, but that's what I
Yeah,
remember, something like
yeah,
that.
yeah. This was one of the first few questions I had when I was starting physio. Like because in the literature, like not the literature, sorry, in my syllabus from what the school teaches us, everything we use has a pain relief effect. Heat, pain, like heat, ice, electrical stimulation, stuff like that. Um, for most people, I would say, um, do whatever you fucking want. Like you're not going to be like 5 months down the road and be like, fuck, I should have iced it more. Like that's why I'm progress is fuck. Like, right? Like you have to like zoom out and look at the actual like macro like progress. Not to say like, icing is never beneficial, never helpful, or like heat is never beneficial, never helpful. For example, what I think most people cite is when they talk about like ice studies is that there's this one by Squat University that he cites a lot about like these rats who were like crushed by something, and then they iced it and saw that like the healing process was delayed. It's like, yeah, like I guess you could generalize it to humans. If you were like crushed by a car, like I wouldn't recommend you to ice it, I guess. Like like um and yeah, this goes to another thing as well, is like there's a bit of like logic like problem in physio. It's like, oh, you want to stop the inflammation by icing, and then we'll go ahead and do massage because it improves like blood flow. Like what the fuck do you think that does? Like what do you think blood flow is? It's inflammation. Like you're promoting like blood to like that area, or like you're doing exercise. Like exercise has like inflammation to it as well. So like, are you trying to like stop like the adaptations that's gonna occur? Because like personally, I wouldn't mess with that, because like for example, if I get an injury, either like I put heat on it, or I just leave it alone and let my body do its thing. Um, yeah, I would just like leave it alone, because like I don't want to mess with it.
But like, let's say you get like a little injury or something, or I guess you get like, I don't know, you cut yourself with a knife because you're trying to cook. I guess icing. I don't even know. I don't really
And
ice.
you should use tape on that one.
Yeah,
That's
I don't really, I don't really ice my
you
cuts.
should.
If anything, I used to think that I could cauterize them, but just like getting the like the little lighter to use to light a candle, and I just kind of
Oh,
do that. I used to
oh,
do that. I used to do that. I was an idiot. I'm like,
did it
it's gonna heat up
work?
the blood. It's gonna turn solid or whatever. Uh,
Yeah,
I used to think that, but
yeah,
I mean, yeah, at most, like I, I would sometimes ice them, and like when I would go to physical therapy when I fractured my fibula, um, I like they would put ice on it for like the first 5 minutes or something, and it feel nice, like
yeah,
nothing
yeah,
wrong with that. And so I mean, that's also what I incorporated into when I was reading the icing
yeah,
literature a little bit. I think a nice paper came out in 2020, sometime around there, saying that like it's not the end of the ice age. That's how they call it.
yeah,
Um,
yeah. Um,
that it does have a place, I think.
yeah. In some populations, for example, in the ACL population, for example, the people who got the ACL reconstructed, I have seen this paper where like they ice the quads for 15 to 20 minutes compared to no icing. I think it's compared to no icing, and it showed that they had like a greater force output for people that did the ice. So like that's one of the things that I would use for it. For example, like I would think the reasoning is like, you're waking up the muscle or whatever. But then if the same thing happened to like heat therapy, I would say the same thing as well. So I don't know. Like like for both sides, I would be like, yeah, it probably warms up the muscle or something. But then again, like we really have to zoom out, like as in like, listen, maybe there's some like thing about like icing that we haven't discovered yet. But am I really gonna dive like, you know, spend most of my time reading like physiology and like icing and its benefits? Um, when like its supposed benefits are like so micro that like it might not even be worth looking at, because that's what not what people are dealing with. They're not wondering if icing is optimal or not. They just want to go back to whatever they're doing, which is like, like
Yeah,
it's
that's true. I mean, I don't think icing is gonna heal your. It could probably delay. I don't know, like a bruise or something. Like you said, it could
yeah,
delay a little bit. I don't know if a bruise would be the right little injury, but it could just delay recovery in some sort of way. But
yeah,
I
yeah,
don't think it's gonna help with like. I mean, you broke your bone, you fractured it. You're not gonna put
yeah,
ice on it. It's not gonna heal back better. It could delay it, but whether it delays it for so long, I don't know if the delay is like that noticeable too. Like, oh,
yeah,
like if you ice your bone when you fractured it, it's gonna be like, it's gonna be delayed by 4 months. Like I don't know if it
mm,
has that big of an impact, sort of way. Maybe I could be exaggerating, especially like I don't know if I'm using the right injury for this context, but things like that,
yeah.
right?
I would say it's like way too minuscule for like the average person to care about. It's just like, as long as you have a good plan in place whenever an injury happens, do whatever the fuck you want. Like tape it, ice it, I don't care. Like as long as you have a plan in place, as in you have like a solid plan to like progress, right? Do what you want. Like I don't care. Like as long as you don't like pedal it and be like, this is the one thing that like really got me back to sport, when it was like the programming that got you back to sport. Yeah.
Yeah, and it throws me off because you see all like these physiotherapists on like the football games and all that, and then I think there's a video with one of them doing it with a soccer player. Like it was so painful. It was like I don't know if it was ACL tear or something like that. I'm pretty sure you've
Oh,
seen
was
it.
that Neymar?
Yeah, it was a
Oh
Neymar.
yeah. Oh fuck. Yeah. Yeah. That
Like
that that video was like, it was circulating in the like the physio scene. Like that's not what, you shouldn't ever do that. Like
yeah, no, and these guys get paid so much for it, and it's like
yeah.
for like it's so like their stuff is their methods are so outdated. Well, I mean, here's a cool little fact. I think a lot of the I think physical therapy or like uh, cool things that we learn today is a lot from like that torture from the medieval times.
Yeah.
Um, when they like in the I think in the Middle Ages or I don't know my history labels that well, but in the Middle Ages, like they would torture people so bad, and they'd have many like gruesome ways to torture people, but that actually did help them understand the body a little bit and did help develop the field of medicine in a way, which I found interesting. Uh, I haven't read papers on that, but I've had a history professor tell me about that, and that kind of just stuck with me. And I'm like, well, it makes sense. I mean, that's cool. It's not cool that they
Mm.
did that to those people, but I mean, I don't know. Who knows what they did? But yeah, I mean, so I guess moving on from icing injuries, I've seen some people try to ice tight muscles, right? And
Yeah.
whether they exist. Now, I don't think muscles get tight. I think it's more
Mm.
so their orientation on
Mm.
how they're put in place. But then you have people like feeling the skin and like, man, I feel this knot here or
Yeah.
something like
Yeah.
that.
Yeah.
But I've also seen research papers saying that we can't even uh like know where the knots are. Like they had like some physical therapists try to do that, and then they're like, no, you guys didn't point it out actually correctly. The knot was
Yeah.
not there.
Yeah. Okay. So to address your points, the second one was about, well, what you mean by trigger points. The first one was about. Sorry, I forgot.
Well, I guess they're both two different ones. Tight muscles and trigger points. But we
Right.
could let's do tight muscles first, and then
Yeah. Okay. So tight. Like if you notice throughout the podcast, like I'm trying to think of like a scenario, because like you deal with like I deal with like very like specific populations, and I don't want to say something that doesn't apply to like one another, but I also want to give like I don't want to say it depends and then like just fuck off with it. Like but
that's how you're
um
safe. That's how you're safe.
yeah. Um but for example, you have people have to know that a sensation of tightness does not really correlate with range of motion. So, like, let me repeat that. A sensation of tightness does not represent how much your joint or your muscles like elongate, right? for example, like when I first started like exercising and working out, like I never incorporated any hamstring stretch or did any like straight legged like deadlifts and stuff like that. And my hamstring range of motion was like bunk, was like maybe like 60 degrees. Like when I raised my leg 60 degrees, it would just start like feeling really, really tight. But I had no sensations of like tightness in my day-to-day life or day-to-day activity because I just didn't require it. Right. And again with that, I have like, for example, like sometimes my neck gets sore, but my range of motion for my neck is completely fine. There's not like, oh, if you reach 40 degrees, you're fine. But once you get to 39, your neck will start feeling sore. So like there's not really a cutoff point for that. And what they actually like tested this. So let me go um take a look at this. So I have to find it. Give me a second.
Yeah, I feel like people don't really fully understand the concept of tightness, or when they say a muscle is tight, what do they mean by that? Like, is it like knotted up? Like,
Yeah. So yeah, there was this study where the neck muscle stiffness was measured with elastography. Um just a thing. Um so like they took the people's like reported sensations and then they measured it with like the actual stiffness of the muscle to see if there was a correlation, and there wasn't. This paper is by uh no author. Angela 2020, um Dieterich, right? There's been a couple of studies that do that. So like they just test your range of motion and then test like how stiff you feel, and then they saw that there was no correlation. But I would say like muscles do, from what I've seen, they do elongate, as in the fascicles, they do get longer. Um, but it's mainly neural in the first 6 weeks, as in I don't want to say like first 6 weeks, but like for example, if I take an untrained like individual and I tell them to stretch for the first like few weeks, few sessions, it's mostly your nerves telling your body, okay, it's safe to be in this range. Okay, and then once we keep desensitizing the nerve, like that's the key word. It's like a lot of what we do in physical therapy and for pain, it's desensitizing like the body to like making the body feel like this is okay, like we can keep doing this. Um, then the muscle is the actual limiting factor, and then we have to get into like stretching is like in some studies where like they stretch like the calf, like there's some hypertrophy in the calf, like compared to like um I think they stretch it for like overnight for like 7-8 hours, and then the results were comparable to actual resistance training your calf 3 times a week. So that was a pretty cool study. But
that
yeah,
is pretty cool. But
yeah. What
yeah,
was your other point?
it was talking about muscle knots, I think was the other one.
Oh yeah,
Uh,
yeah. So yeah, yeah, muscle knots don't really exist. I would say they don't really exist in a way where like we can't really like identify them. So like it's just this really funny. Like imagine the scene, right? Like this happens in every PT school. So like you have a lecturer, right? They'll take up a student, like they'll go up to the front, and then the lecturer will start feeling on someone, and then like he'll touch your area, and then you'll be like, ow, and he's like, okay, it's there. Now everyone go try and touch and feel it, and like everyone would get like mixed results, and then like sometimes you see a shift where like the lecturer would be like, yeah, it's right here, guys. Everyone touch it. And then they're like, oh, yeah, I feel it there. I feel it there. And there's just like a couple of us just running around, just be like, I can't fucking feel anything. Like there's no difference. Like, and it's really subjective because like, um, yeah, we can't really identify it in studies that they have tried to identify it. Let me try and find it. Um, they have tried to identify like for example, which is the painful side by just palpation, and it was only 60% accurate, as in like it's a fucking coin flip. Like if you did a coin flip, it's like slightly better chance of the coin flip, which if you use that as like a diagnostic tool, it's not really a good diagnostic tool because like you could just ask the person, does it hurt when I press here or here or here or here? And we do get sore spots in some areas. Um, for whatever reason, I don't fully understand it yet. Maybe you overuse the muscle. Maybe there's some like metabolic stress that's like in that muscle that just won't go out. Um, but we can't really identify it by touch because yeah, your muscles don't really knot. That's not a thing that they do. Um, you know, just muscles don't really knot. I don't know what else to say. Yeah.
I it wouldn't. I mean, it wouldn't make sense to me if I see like, oh, like the fibers they're arranged, and all of a sudden they just twirl up like that. Like,
Yeah.
how would that? And then you think like kind of doing this over
Yeah.
layers and layers of muscle mass, especially on your back, it's just gonna flatten them out again.
Yeah. It's like you try so hard in the gym to like, you know, strain and deform muscle so you grow to get bigger. And some guy just does it to you on the table with like his hands. It's like it's that easy.
Yeah, no, I when someone tells me they have enough, but I think there's a cool like it's an interesting relationship because it's like, oh, like my neck feels really tight, and then you press it
Yeah.
there, and it's like, oh yeah, that's it, and then they do feel better.
Yeah,
But
yeah,
like you
yeah.
said, it's just like desensitis desensitization. Oh my
Yeah.
gosh.
I think a problem with a lot of like physio or fitness, maybe it's just me, but a lot of the times we don't understand what's going on and we try to create these like bizarre explanations or like really fascinating explanations behind it, which is good. And don't get me wrong, I have no problem saying like, somebody telling me they have a muscle knot in their back. I'm not gonna be like, that's actually not true. And I'm gonna spend like 10 minutes. I'm not gonna fucking do that, right? Like I don't want to be that guy. Like I'm just feeling, people are gonna have their beliefs and stuff like that. Not everyone is worth fighting and dying on the hill for. And I've been that guy. I've been like, guys, that's actually not true and stuff like that, like in class and like telling my classmates, which is good because like they're actual physios. But for the general population, I'll just be like, oh, made you feel better. All right, great. Like I don't have to like touch that anymore. Like I don't want to like be that guy to spend like like 15 minutes be like muscle knots like there's just study over. It's just like as much as I would like to do that, nobody wants to hear that shit. Like
It's like when you go buy a car or something. Like I'm not. I'm gonna be honest. I'm not a big car guy. Just
yeah,
I'm okay with a Ferrari. Uh, but
yeah,
I don't need a Nissan like turbo or Nissan GTR, whatever. When I go buy a car, I don't want nobody explaining to me like this engine does this, this, and this. It works like this. Here's the tube system or
yeah,
whatever. Like this is the
yeah,
coolant. I suck with
yeah,
cars, but
yeah,
uh, like it's not that. Like it's just like listen, it works. It's a nice car. The interior, it doesn't, it runs good on gas, whatever it is. Like that's kind of
yeah,
what I care about. I don't need somebody to go in depth with me and explain to me why that's the best engine compared to the other engines.
yeah,
I should know about cars, but
yeah,
at least a little bit. But anyway,
yeah.
yeah, I don't know. I mean, sometimes when I sleep bad on my neck, or whatever, like
Mhm.
I wake up with my neck feeling horrible, but I'll just
Yeah,
like
yeah,
press on it or something, and it would just feel better. But I don't
yeah,
think it just like crumbled up or anything. It could just
yeah,
be like out of like it was probably like in a shortened orientation or something for a long period of time, and then obviously when you move out of it, it's just gonna give you like
yeah,
a sensation.
yeah.
So
Yeah. Uh, it, I like to explain it like I think with all the studying and the research that I've done for physio, a lot of it boils down to what would I do if I was a caveman? Like, like I treat it like this. Like, what would I do if I was a caveman and this person presented with me like this, and I was like, it was like fucking 10,000 years ago. Somebody comes here, they're like, my muscle is tight, stuff like that. I'm gonna rub on it and see if it feels better. Like that's it. Like let's leave it at that. Like I'm desensitizing something. Why did your neck feel bad when you were sleeping like a different way? Well, because you slept a different way and like your body did not move in that 8 hours. Like you try stretching your neck for 8 hours and see if that feels good. Like that obviously it doesn't.
That that's another thing too. People are in airplanes and they're like, man, I'm sitting for so long for hours. Let me go stretch, and they're not even stretching. They're contracting. Like
Yeah, yeah,
you're sitting in a more lengthened orientation on the plane seat. Your glutes are more lengthened. Like,
yeah.
and then as soon as you stand up, like, oh, that feels good. It's like, yeah, but you're contracting them now.
Yeah,
Like,
yeah.
it's not
Um,
just like lengthening muscles feels better than shortening them.
yeah, I think it's the movement. It's like I always advise people don't stay still in one position for too long and don't get sucked into the good posture, bad posture thing because if you're sitting with a quote unquote good posture, by the way, like there's like a million studies that like just showed that there's absolutely no correlation that comes with posture and pain. It's just way more complex than that. Like neck pain, back pain, like they try to like track people over time to see if there's a correlation. There's none. So like sit however you want, but make sure to move. Like as in you can walk for like 3 hours straight. But if I tell you to stand still and not do anything for 3 hours, even if you have entertainment, you're gonna feel fucking sore. Like
Dude,
you're
yeah.
not gonna feel very good because like our muscles are kind of like sponges, like they're transporting like nutrients, blood flow everywhere to the body. So like whenever you contract, whenever you relax, contract, it's spreading like the blood flow throughout. So like it's just like the body just doesn't feel very good when it's just like staying still.
Yeah, it's like even when I sleep for a very long period of time, which doesn't happen every day, unfortunately, but when I get a good amount of sleep, or let's say I sleep over 8 hours or something, I wake up feeling like crap. Like my body just feels compressed. I'm like I don't
Oh,
like staying in bed for so long. I gotta get up.
yeah,
Or when I'm on the couch, right? I'm sitting, I have my good posture, whatever. There I am watching Lord of the Rings extended editions, 4 hours and 50 minutes. My back starts feeling like crap. I
yeah,
gotta move. And even in this podcast, me and you, we're just
yeah,
moving shit. I don't know, like, because if
yeah,
I just stay like this the entire time,
yeah. It's gonna hurt.
my back's gonna hurt, or it's
Yeah,
just gonna feel. It's not gonna feel good.
yeah.
But I want to get into like one of my favorite topics is unstable surface training and
Ah,
how
fuck that.
athletes. And all right, that's
Fuck
it.
that.
That's pretty much all we need to know. But how athletes are being trained. I love seeing those athlete videos on social media, like Jake Paul, like core training, doing the what's that cable press called again?
Olive press.
Yeah,
Yeah, yeah,
just stuff like that, or just like athletes on a Bosu ball and like learning how to
yeah,
produce force on an unstable surface.
yeah.
Those things, and I guess it's very hard for me to think of a valid reason to say the Bosu ball is actually the best thing to use for this context,
Oh
because you could
no.
be like, oh well, same thing with with the shoulder press. When people do an upside down kettlebell, like, oh, that helps with shoulder stability.
Yeah,
I never do that shit. I
yeah,
always press with just a regular. If I'm gonna press with the kettlebell, but as soon as I try to do it with an upside down kettlebell, I could do the same thing. I,
yeah.
I feel like
It's
they're
usually
both.
because of grip strength. See how
Yeah.
hard you can grip.
So I mean,
um,
I don't know what you think about that.
yeah. Skeptical physio made a really good post about this, like unstable surface training. But I think I'll break it down easily for people. If you want to produce force, you have to do it in a stable surface. You can't jump on like a fluffy mattress because you just can't produce enough force to go into the mattress. It's easier to jump higher on like on the like the hard surface, right? And obviously, I'm not saying like unstable surface training is useless. Like for example, if you want to get back to skateboarding, stuff like that, or like if you're a surfer, yeah, sure. And it does have its own benefits. Like for example, you're relying on your eye more to like getting that connection. Like for example, seeing where your body like goes, while using your eye to like adjust instead of your muscles because your muscle can't really like they can't really produce. It's not really a force production like thing because your muscles can't really produce force. So like they can, but it's not to like stimulate like that part of training. And if you want to train like co-contractions, which is like, yeah, that could be a good way to do it. For example, like all the muscles contracting around a joint to stabilize it, quote unquote stabilize it. Yeah, that could work for whatever reason you want to justify or like you want to train that ability. Sure, like, but mainly if you want to get better at squatting on a Bosu ball, then you squat on a Bosu ball. Like I guess if that's what you want to do, but if you're doing that in hopes of having more quad strength or like producing more force with your limbs in general, yeah, good fucking luck. Like you're not you're not gonna do anything. Like and it really frustrates me because the physical therapy field, the field where like, you know, people need it the most, like actual like good strength training, they get sucked into like these like quote unquote functional things. They're like, oh, you know, the unstable surface like makes your muscles more functional by increasing more like doing more stable, like it makes a muscle more stable by like making it unstable. It's like, okay, first that's just a really big pet peeve of mine. It's like we can't fucking define stability. Like, how do you know if something like stable or not? Like, for example, um, and we shouldn't only focus on quote unquote stability. Like, if you injure an area, whatever that be, a knee joint, an ankle joint, a lot of qualities is going to go down the drain. Like muscle mass is going to go down, tendon like health is going to go down. Like there will be some a muscle inhibition, which means the muscle shuts off like around the ankle joint or like up one joint or below one joint. So for example, people with knee pain, they tend to present with hip weakness as well. So because the body just shuts off like the entire joint, not completely shut off, but depends on the severity of the injury. For example, famously the ACL, the quads usually just go to shit like with the ACL. Like the quads, like they just die off, and you really have to like work on strengthening it. And leg extension will be your best friend. Like you have to find a way to isolate the quads because when you don't, the body will find a way to compensate and it will look completely symmetrical to your eyes. And there's a study done on us. It's by Sigward. I think it's called. I think her name is Suzanne Sigward, where they did force plate testing, and they found that the body compensated between the limbs and within the limbs. So like the quads would do less work by transferring the forces to the glute max and the calves, but it looked completely symmetrical. So like the eye test like just won't cut it, right? And like these people, they really need leg extensions or something to strengthen the quad, but instead you like something to get the quads like force producing. You want to like make them produce force, but instead you throw them on a Bosu ball where they can't do that. Like it's really like counterintuitive, you know? It's like not to say it won't have its place. Yeah, go ahead, like you know, do that at the end if you want, but that shouldn't be the meat and potatoes of your like programming, right?
Yeah, I think an argument that I hear with the Bosu balls and stuff like that is that it's a good way to train the muscle intensely without adding so much load to it. So it's like, let's say, like, oh, I can't press with a heavy kettlebell in order to
Mm.
stabilize my shoulder, whatever, or to train my shoulder. So I grab it upside down. That way, it would have to contract harder when I press up. That's like
Yeah,
that's the argument I hear about it, and I mean, I don't know. I can't think of like, I haven't thought of like the best way to counteract that other than the fact that
uh,
it's like you probably can lift heavy, just lift with more. Like I don't know if lifting with more reps or anything like that would help with that. I don't know. I
yeah. Like I like to think of it like this. For example, a person's shoulder joint right now, it can handle 15 kilograms of load for 10 reps. And their usual working weight is like 30. Okay. Let's just say like if you're looking at the shoulder joint, like let's say this person's like shoulder joint, the socket, it can only take 15 kilograms of force. But the athlete still wants to train. but they can't use their normal working weight. So you use whatever like whatever exercise prescription you have in your mind to try to like get to that 15 kilogram mark, which is meeting the athlete where they're at, while like entertaining them almost to a point. But you have to understand that and not get sucked into it. Like you were stabilizing your muscles or whatever. You just like, if a person wants to press 400, like 400 pounds, we start by wherever he's at, and then we slowly progress to that, right? Not to say we don't want to do other things. Obviously, variability is important, but you don't you don't want to like stray so far out where like you're not doing the thing, which is like producing force. And yes, um, squeezing your muscles or co-contracting or being very aware of what your shoulder or whatever joint you're doing is really helpful for people in pain because it gives them a sense of control. But yeah, we just have to differentiate that, right? It's just like
Okay.
yeah, it's just like I like to think of things in like a very like bare bones kind of way, like as in what can this person tolerate? Like let's say think of a number in your head, like yeah, you can tolerate like 30 repetitions of this. How can I like meet them at this level while keeping them like since they're people, like you can't just like sometimes they just don't want to do something because they don't feel the need or they don't feel the attraction. So that could be a good way to like ease them into it, like while making something feel challenging when it's actually like not really that challenging, it's just mentally fatiguing, could be a good way. Like again, if you notice, like a lot of my answers, they're a lot like the taping a hairbrush to my back analogy. Just like, look, you can do like 50 different things, like I can justify it like however I want, but I think you just have to look at that person in front of you and like being like, okay, what is actually happening? What am I trying to do? What stimulus am I trying to give? What adaptation I'm trying to like give it? Do they need an adaptation or something? I like to think of it that way. You know.
Yeah, I think that's good. And I think, like I said, that's probably like the most reasonable way someone would use like an unstable thing to train a little bit. Like again, again with the upside down kettlebell. Like honestly, sometimes if my shoulder is feeling crappy, I would play around with that because I keep
Mm,
playing around
mm,
with
mm,
some things that I am iffy on. But I'll play
mm,
around with it. It would, yeah, it'd have me squeeze my forearm, and it'd have me contract my shoulder. Feels a little bit
mm,
uh, contract a little harder.
mm.
Charrington's law of irradiation, I think it's called. I think
Yeah,
that's it. But yeah, I mean, I'll do that. My shoulder would contract hard and stuff like that, and then after it'd feel better, and then I'd
yeah,
press easier. So it's just stuff like that. But I mean, I understand. It's like, well, at the end of the day, it's not like this is stabilizing my shoulder more. It's just more contracting. But I don't see it as a muscle building thing. I just
yeah,
see it as
yeah,
like
yeah,
a warm up in some sort of way.
yeah,
And even as a warm up, I don't over exaggerate how good it is.
yeah,
Sometimes it works, sometimes it doesn't even. So
yeah. Yeah, that's a good way to look at it. It's like you're just trying to like load it differently or like give it a different stimulus to desensitize it. Like that's the key word in this podcast. Like obviously like not everything um can be desensitized and like the problem just goes away completely. For example, if your program is garbage, like for example, if you bench like 5 times a week and you're hitting RPE tens all the time, obviously like okay, like we have to look back a little bit, look at the macro stuff, like what are you doing like to like making your shoulder feel like that? Maybe you had a past injury or something. But yeah, yeah, like I think a lot of people they just tend to focus a lot on the micro side of things. And I get it. It sells well, it markets well, like, you know, but nobody really wants to hear like, what do I do like with this injury, like I don't know, program better, like buy a better program or like get a better program to like get
yeah,
you
they
back
think
into
they
like
can. They think like, oh, my shoulder hurts. Just do a serratus kind of uppercut press, and then no, she'll
yeah.
feel better.
Yeah,
It's
yeah.
more than
It's like
maybe.
yeah, Yeah, yeah. Just keep doing that. Don't address like benching 5 times a week. Like, don't address that. Just keep doing more rehab exercises.
Yeah, and another thing is like, you see people like, oh, like squatting on a Bosu ball, and like they probably have a lot of leg strength. If you squat really heavy, or you do like single leg squat really heavy, it's very easy for you to do a single leg squat on a Bosu ball with just like a
Oh,
little bit of
yeah,
practice, just a little
yeah,
bit. The person who could do a single leg on a Bosu ball probably um, may not be able to do like a heavy Bulgarian split squat, but the person who does a heavy Bulgarian split squat could probably like with a little bit of practice easily do a single leg on a Bosu ball.
yeah. But which one's
Unless,
gonna get more Instagram likes? So.
yeah, that's true. Unless that's a whole different story. And I mean, even then, I think there's like context stuff on what I just said about the Bosu ball and the Bulgarian
Yeah,
split squat, because it also depends if the person who just loves freaking doing single leg on the Bulgarian on the Bosu ball is just happens to be really good at Bulgarian split squatting too. So I think it's vice versa. Anyway, um, I think we could call that all the topics we pretty
awesome.
much hit.
Yeah.
Um, Keith, I appreciate your time here.
All right.
Do you know where people can find you?
My Instagram is at keefe.physio. You can find me there. You can just DM me if you're a student or like someone wants to get into physical therapy, or if you're dealing with an injury. Either I can help you or I can send you somewhere that where you can get help, because I'm not an all-encompassing guy for all injuries. Like, I have certain ones that I do like, for example, tendon stuff, you know, pain, uh, but there's some things that I refer out. Yeah, that's about it. If there's any takeaways from this podcast, it's just like, learn to be a bit more skeptical. Like, even as a physical therapy student, you would think in school they would teach you like, like mostly useful information, but I had to learn a lot of my stuff like, online on like PubMed, and like it's usually also like frowned upon because it's not part of the syllabus, and like, yeah, you have to like obviously study the syllabus to pass. Yeah. Be more skeptical, like focus on the macro side of things, like don't get sucked into um not to say that they don't help, like for maybe there's one really specific person that really like benefits from like icing some inflammatory problem or whatever, like sure. But for generally for most people, these are not really the things you should focus on. Uh, have a good physical therapy plan. If you're dealing with an injury, like have a good physical therapist that shows you what your road to sport or road to basic function is going to be like. Not just like, I'm going to slap on this machine for you, put ice on it. Yeah, you'll be fine. You know? All right.
Awesome. Well, thank you guys for watching, and I will see you on the next podcast.